Hi, hello, welcome back to my channel. So, today we are going to see about the medicine Cina maritima. So, as you see the picture, it is the Cina plant. It is known as worm seed and it is of the family Compositae and the brewer is Honeyman. So, as the name suggests, the worm seed, it is the main complaint of worm complaints. So it is adapted to children with dark hair, very cross, irritable, ill-humored, want to be carried but carrying gives no relief, does not want to be touched, cannot bear you to come near it. So if you see, these children doesn't like anyone to go near them, but they want to be carried. But when they are carried, it gives no relief. But in the case of chamomilla, they wants to be carried, but carrying gives relief. They desire for many things, but rejects when offered. And if you see about their nose, they'll be always digging, boring, and their nose will be always itching. They'll rub their nose in the pillows or on the shoulder of the nurse. And the children has mostly worm complaints during teething. They'll always be weeping, pitiful weeping. That is when they are awake or when they sleep. And in between these sleeps, they'll be screaming and they'll be grinding their teeth while sleeping. Some complaints are of ascarites, that is the disease caused by the worm called ascariasis, because it is the medicine for worm complaints. Their face are pale, sickly, whitish and bluish appearance around the mouth, sickly and dark rings under the eyes. One cheek is red and the other pale. Canine hunger soon after full meal, craving for sweet and different things. Refuses mother's milk. So, if you see their face, they'll be very bluish. That is around their mouth. They'll be having bluish circles, and around their eyes, they'll be having dark circles. And also, they look very pale, like icterus. And their one cheek, if you see, it will be red and the other will be pale, and they'll be having canine hunger. What is meant by canine hunger is that even if they eat till their stomach gets filled, again they'll be feeling hungry. Like most of us will be feeling the same, but it doesn't mean the disease. It's not a disease, okay? It's a characteristic symptom. It's just a character of a person, okay? So no need to get afraid if you feel the same, because I do feel, because we'll be having a full meal, and after that, after 30 minutes, we'll be feeling to eat some snacks, okay? So they'll be craving for sweets and many things, many different things, in the case undigestible things like chalks and etc. They refuses mother's milk. If you see the urine, they are turbid when passed and they turns into milky when they are left for some time. After some time, if you see, it turns thick, semi-solid and white turbid. They are involuntary. Involuntary urine is also known as enuresis. Nighttime involuntary urine is known as nocturnal enuresis. Okay, it is common in children's. And cough, if you see, it is very dry, and along with the cough, they'll be having sneezings, and it is spasmodic, means it will be recurring intermittently, periodically, with gagging in the morning, that is periodic, and it returns during the spring and fall. During the spring season and fall season, they'll be having this type of cough recurrently, periodically. child is afraid to speak or move, so they are having fear of speaking or moving, because if they move or if they speak, they'll be having cough. So these cough is like they are afraid of the cough. We'll be uh, feeling discomfort when we have coughs, right? Coughs along with sneezings and etc. So they are children, so they'll be having a bit fear of it. So they'll be avoiding to speak or motion. Okay. So these are the important characteristic features of Cina maritima. And if you see about the relations in pertussis, after rosra has relieved the severe symptoms. So in the case of pertussis, next to rosra, the Cina can be given. It can cure severe symptoms also, and has cured aphonia from exposure. When aconite phos and sponge has failed, aphonia means loss of voice. So in the case of aphonia, if aconite, phosphorus and spongia fails, you can give Cina maritima. Then it's frequently to be thought of in children as an epidemic remedy when adults require other So it is the main drug for children and not for adults. So sometimes, not sometimes, mostly this won't work in adult. So it is the main remedy for children. It can mainly given to children, but in the case of adults, it is preferable to choose any other remedies. Santonin sometimes cures in worm affections when Cina seems indicated but fails. So Santonin named another remedy is there. It can cure worm affections in the case of failure of Cina maritima. So for exams, if you see, comparison can be asked. Cina is mostly asked for worm complaints and for children. So in comparison with chamomilla child versus Cina child, some more similarities are there and few dissimilarities are also there. So this is the most common question asked. Cina comparison with chamomilla. It can be asked in 10 marks. In case of separately asked, or in the case of 5 marks, it can be asked as a single remedy, that is about Cina or about worm complaints or GIT complaints of Cina. Okay, so that's all. This is a short and very simple drug you have seen. So again, this is a child. You just imagine the drug picture of the medicine. It's a child, always boring, always crying because of worm complaints, teething, grinding, peevish, crying, wants many things, does not like to be touched, always feeling hungry, aversion to mother's milk, urine turbid, uh, turns milky, semi-solid, cough. So that's all. Okay. So bye. Let's meet with another drug. Ta-da.